MPs were told today that medical or medicinal cannabis should be legalised for more people, not just those who are terminally ill and or near death. Parliament's Health Select Committee has begun hearing submissions on what's being described as contentious legislation. Our health correspondent Karen Brown was there, and Karen filed this report.
The bill would allow terminally ill people who have less than a year to live to possess and use medicinal cannabis. The director of the Drug Foundation, Ross Bell, told the committee that those with severe and debilitating conditions need to be protected from prosecution as well.
Only focusing on terminal patients isn't good enough, and in reality, terminal patients aren't getting arrested by the police, but many other patients are. And the way that police use their discretion means that a lot of people are getting prosecuted still.
Ross Bell says those who support terminally ill patients also need legal protection.
The so-called green fairies, people that will be administering the medicine or even cultivating the medicine, and I think, again, you're going to hear stories of people who are on their deathbed or are severely physically limited that they can't access the medicine, they can't even administer the medicine.
The Green MP Chloe Swarbrick, whose more liberal medicinal cannabis bill was voted down by Parliament in February, told MPs she wants to see the legislation advance, but not without changes. In particular, because there are gaps if cannabis is made legal for just those who are terminally ill.
That doesn't make medicinal cannabis legal. It doesn't address access. It doesn't address availability. It doesn't address the quality of the product, and it certainly doesn't address affordability. It doesn't even provide a legal way for terminally ill patients to get the medicines that they require.
Ms Swarbrick added that it wasn't good enough not to provide legal protection for cannabis growers.
We're all quite aware of the gaping black hole that presently exists. I'm aware that my bill was evidently voted down because people were concerned about the provision, the so-called grow your own provision. But what we have right here is people still needing to get access to cannabis illegally. Somebody has to grow it.
Shane Lebrun from the Medical Cannabis Awareness New Zealand charity said those most at risk of being prosecuted for illegal cannabis use are not the terminally ill.
I'm quite plugged in with who's getting busted by the police, and it's not terminal patients. There's no one who's 2 months from death's door that has the police knocking on their door. So that whole part of the bill was actually toothless.
Shane Lebrun also asked whether others who are very ill but not near death need medicinal cannabis for pain relief.
Are we happy with really sick people to be hauled before the courts for growing something that helps them, especially when the legal options cost thousands of dollars a month?
The College of GPs said doctors want the best for their patients, but clinical trials and MedSafe approval are needed before medicinal cannabis is made more widely available. Asked if those with chronic illnesses should be included, the college president, Tim Malloy, said doctors would struggle with who that would cover.
That's going to be the issue. It's not whether this applies to them or not, it's how do you define it, and what are the criteria, and what do you have to have tried beforehand, and things. So there's a whole body of work that needs to be done to define that for us.
Doctors also told MPs deciding which patients are terminally ill and have just 1 year left to live may also not be easy. Mō te hotaka o te ahi ahi, ko Karen Brown tēnei.